Hello, and thank you for joining us here on Health Professional Radio. Depression and anxiety cause tremendous pain and suffering, and prescription drugs are often laden with side effects. Sometimes they don't work or they don't work well enough. Our guest in studio today is Dr. Adrian Lopresti, a clinical psychologist in private practice and senior researcher at Murdoch University in Western Australia. He has over 18 years of clinical experience working with children and adults suffering from a wide range of mental health conditions, including depressive and anxiety-related disorders. Welcome to Health Professional Radio, Dr. Lopresti.
Thanks, Neal.
Give our listeners a bit of background about yourself. You're a clinical psychologist. Were you always interested in psychology?
Yeah, I decided at quite a young age that's something that I wanted to do. So from a very young age, I've been very interested in psychology and I suppose human behaviour and how we can help people who certainly suffer from mental health disorders.
So what was it that drew you to depression and anxiety specifically that caught your interest?
I suppose because it's the most common form of mental health problems. So they're the conditions that people mostly come into my practice suffering from. So I really wanted to look at investigating alternative ways or additional ways that we can kind of enhance the treatment for both those conditions.
When you're mentioning integrative treatments, what is the major difference between integrative treatments for mental health disorders such as depression and anxiety as opposed to standard treatments?
Well, the integrated treatments can include the standard treatments. I suppose that the thing here is that my concern out there is that people are looking for one solution, a magic bullet to treat depression and anxiety. And what we're trying to do is, a lot of research is trying to do is kind of enhance a particular psychological treatment or a pharmacological treatment. Unfortunately, what happens there is that you're really only targeting one area. So we really need to look at a whole gamut of potential causes and solutions to a person's depression and anxiety, and things like your diets, exercise, sleep, and really incorporating all those different factors to improve somebody's mental health problems.
How does diet play a role when it comes to anxiety and depression?
Well, diet has several influences. So, obviously diet provides fuel for energy, and which is extremely important for day-to-day functioning. But our diet is also really important for production of several hormones and neurotransmitters associated with depression and anxiety, such as serotonin and dopamine. And if we're deficient in essential nutrients, particular amino acids, or if we're deficient in certain vitamins and minerals, which are important for cofactors for the production of serotonin and dopamine, then production of those neurotransmitters are going to be impaired. The other thing too is that diet can also have an impact on inflammation and oxidative stress. And what we're finding over the last decade is research is confirming that people with depression and anxiety also have excess kind of chronic mild inflammation, and this can then impact on serotonin production, dopamine production. So we really want to look at decreasing inflammation. And what we eat can have a major impact on that.
Are you talking inflammation in the brain, or inflammation anywhere in the body, or everywhere in the body?
Well, what we're finding is that, if we measure people's markers of inflammation in their blood, they're generally, for a subset of people with depression and anxiety, they're higher. So it's in the body, but the theory is that it impacts on brain function. It's having some negative impact on our brain. So.
When a person is suffering from depression and or anxiety, as I said, do those two always go hand in hand, or are they separate some of the time or most of the time?
Well, many people with depression or anxiety will suffer from both. So, there are a subset of people who may have just anxiety on its own or just depression on its own, but there's a significant portion with both. I think the danger too, though, is that many people, providing an understanding of, diagnosis of depression and anxiety only provides part of the solution. People think that if you create a diagnosis, then you have the solution. Mm-hmm. But the key here is really to identify the causes of the depression or anxiety for somebody. Just having a label doesn't tell you how to then successfully treat that individual. We need to work out what's going on that might be potentially impacting on them, whether it be a lifestyle-based factor, stress, physical factors, social factors that might be impacting on them.
Do you find that often where someone has been using antidepressant drugs or wants to use antidepressive drugs in treating them, do you find that often a simple dietary or lifestyle change, like exercise or, as you said, better sleep will solve the problem? Or does it take much more in-depth study of an individual to determine whether they can get off antidepressants or not and simply rely on lifestyle changes?
Look, I think there's a good subset of people who with positive dietary changes and positive lifestyle changes, that can significantly improve their mood and really treat their mood completely. Now, that's not always the case for everybody, but I think that's the core. I think that you've really got to look at those lifestyle, your diet, your sleep is absolutely essential. If you need to, I do whatever I can to help people's sleep, and if people are sleeping significantly better, their mood just lifts dramatically, and to the point where you don't need to offer any other treatments. So,
do you find that many of the treatments that are effective in treating depression and anxiety are effective treating other types of mental disorder, say ADHD or maybe bipolar disorder with some of these lifestyle changes and dietary changes that you mentioned, in addition to or in lieu of medication?
Yeah, certainly the most of the research I've done is in the area of anxiety and depression. I've also done some research in the area of ADHD, and I think it certainly applies for schizophrenia and bipolar disorder. The dietary changes, the lifestyle changes, it's the core treatment. I think you've really got to look at how we can improve these lifestyle factors first, and then see what happens. Then see, well, what other changes do we need to make? Are there coping skills we need to work on? But I think that's the core, or one of the cores for all mental health disorders, no matter which one presents.
Do you find that younger patients are more accepting of some of these changes that don't require medication, as opposed to some of us older patients who are maybe set in our ways or more creatures of habit when it comes to managing our mental disorders?
Sometimes. I think younger patients can also be very resistant to making those changes. And I think what we've really got to do is look at the individual. There's a big craze at the moment for, your gluten-free type diets. And while they may be beneficial for many people, many people aren't willing or able to implement those changes. So really it's about going, okay, the person that's presenting in my office, what changes do I think are going to be beneficial for this individual? But then the second question is, how motivated is this individual going to be to make the changes? So from my perspective, I'm then looking at, well, if it's not a perfect diet that they're aiming for, then let's look at how we can improve their diet by 10%. Let's engage them with that. Let's get them drinking more water. Let's get them having a piece of fruit every day. Let's reduce some of their takeaway. And although that's a perfect diet, it's an improvement of 10% in their diet. Now you have an improvement of 10% in there. You have increasing exercise by 10% because now, yes, they're not willing to do a lot of exercise, but they're willing to walk to work or walk to school. Mm-hmm. There's a 10% improvement there. They make some changes, and so their sleep improves 10%. And then all those small changes collectively make a very, very powerful treatment. And that's what I'm thinking about. I'm looking at, and that's what integrative therapy is about. It's not necessarily just working on one solution. It's making small changes in several areas, and now you have the most powerful treatment there is available.
How much of your practice implements supplements, and can these supplements replace medication effectively?
I think in some cases they can be a substitute for medication, and I'd use a lot of natural supplements in my practice. I think again the danger though is that people look at supplements as replacements, and the danger is that you then start using supplements much like you use your pharmaceutical antidepressants. It's not the solution; it's part of the solution, and I think that supplements are very much part of the solution. There are several supplements I use on a regular basis with people presenting with depression and anxiety, but I have never ever had somebody come into my office saying I'm depressed, and I've said to them, well, what you need to take is Kirkman, and then I just write it and say goodbye. It's not going to work like that, but absolutely big fan of supplements.
Now, where can our listeners go and get more information about your practice and about Murdoch University as well, and also about this integrative treatment for depression and anxiety?
Well, there's certainly just to find out about the integrative approach, then certainly write down do a search of my name on the YouTube, and there's a few webinars I've done that are available free, particularly talking about the use of curcumin and saffron that I've used, that I've done some research on. So they certainly can do that. In my practice, my website is called Total Body Psychology. So it's total-body-psychology.com.au, and they can just find out a bit about me, and then certainly look at our Murdoch University website. Just type in Murdoch University in Perth, Western Australia.
Well, thank you for talking with us today, Doctor. Appreciate it.
No problem at all.
Okay. You've been listening to Health Professional Radio with clinical psychologist Dr. Adrian Lopresti, and we've been talking about integrative treatments for depression and anxiety. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download on SoundCloud, and also check us out on YouTube.